Electroencephalogram, the record of electrical activity of the brain, that is cerebrum, is called electroencephalogram. It can be recorded by placing two electrodes on the scalp and connecting them via a suitable amplifier to a cathode ray oscilloscope. It was first introduced by Hans Berger. EEG, obtained by placing the electrodes directly on the exposed surface of cerebral hemispheres, that is on the pial surface of the cortex, is called as electrocorticogram, that is ECOG. Normal EEG. The EEG can be recorded by using two methods, bipolar and unipolar. In bipolar method, it is the record of potential difference between two cortical electrodes. For example, one electrode is kept on the frontal area and another one on occipital area. In unipolar method, it is a record of potential difference between an active electrode and an indifferent electrode applied on some part of the body distant from the cortex, such as earlobe. The waves of EEG are classified according to the frequency and voltage. Alpha rhythm. They are present at rest, that is physical as well as mental, when eyes are closed, and form the most prominent components of EEG. Its frequency is decreased by low blood glucose, low body temperature, high arterial PCO2 and sleep. Also, its frequency is increased by high blood glucose, rise in the body temperature, low arterial PCO2 and alerting states. The alpha waves are associated with decreased levels of attention, and when alpha rhythm are being generated, subjects report that they feel relaxed and happy. The replacement of regular alpha rhythm with fast high frequency irregular low amplitude voltage activity is called as alpha block or desynchronization of the EEG. It represents a breaking up of the synchronized activity of the cortical neurons responsible for alpha wave pattern. A breakup of the alpha pattern is produced by an form of sensory stimulation such as opening of the eyes or mental concentration. So here you can see the normal alpha rhythm, and when the person is relaxed, eyes closed, and when his eyes are open, the alpha waves, they are converted into beta waves. The alpha is replaced with beta rhythm, which is also called as alpha block, or it is also called as alert or arousal phenomenon. Again, when eyes are closed, the alpha waves they predominates again in the EEG. So this is the classification of different waves that we see in the ECG. They can be alpha rhythm, beta rhythm, theta or delta. Based on the frequency and amplitude, they have been classified. The frequency of alpha waves is around 8 to 12 hertz and amplitude is around 50 to 100 microvolts, and they are present maximally in the occipital and parieto-occipital area when eyes are closed. And beta rhythm, where their frequency is 14 to 30 hertz, amplitude around 5 to 10 microvolts. Generally, they are seen in the frontal region, normally in the wake pattern, and they are also commonly seen in infants. The theta rhythm frequency is low, 4 to 7 hertz. Amplitude is also less, often found over the parietal and temporal areas. They are also normal in children and in early phases of sleep. Whereas the delta rhythm frequency is further low, 1 to 4, but amplitude is higher. They can measure up to 20 to 200 microvolts and usually appear during sleep. It can be produced by overbreathing or evidence of any organic brain disease. The uses of electroencephalogram. It is used for localization of the pathological conditions like subdural hematoma, fluid collection, which is associated with decreased EEG activity over that particular area. Lesion in the cortex causes local formation of irregular or slow wave in ECG. It is also used for diagnosis of epilepsy. Epilepsy is due to the excessive discharge of the cerebral neurons. Epileptic foci can generate high voltage amplitude waves in EEG, which can be localized. There are different forms of epilepsy: grand mal epilepsy and petit mal epilepsy. Grand mal epilepsy is characterized by loss of consciousness without uh, aura, that is warning sign, and this is followed by generalized convulsions with tonic muscle contraction and clonic jerks. Here EEG shows high voltage, that is up to 1000 microvolts activity during tonic phase, and slow waves uh, each preceded by spike at the time of clonic jerk, and slow wave over some time even after the attack is over. The, the petit mal epilepsy, it is a form of epilepsy in children characterized by abrupt loss of consciousness without falling or incontinence and lasting for few seconds. Here, EEG shows 3 doublets per second and each consisting of a typical spike and rounded waves.